Mr. Speaker, I have tasked, I believe that the money should have been focused on completing a number of hospitals and making them operational instead of spreading it over the current 111 hospitals. As I speak, some are at the foundation level and not a single one is operational. I have directed the Minister for Health to present us with a plan on the way forward for this program. And let me add that we are open to public-private partnerships and franchising to complete and operationalize these hospitals. Mr. Speaker, one of the most pressing issues confronting our health sector today is the USAID's sudden 90-day pause in services without prior notice and the looming threat of complete withdrawal of programs that do not align with the USA's strategic interests. Programs that will be affected include the delivery of medical commodities to regional medical stores and health facilities in the Upper West, Upper East, Northern, and Savannah regions. USAID support for the National HIV/AIDS Control Program includes the supply of antiretroviral therapies in the Western, North, and Afro regions. These will also be affected. The withdrawal puts at risk approximately $78 million in earmarked funds for malaria, maternal and child health, nutrition, and HIV/AIDS. It also covers some programs being run at the Noguchi Memorial Institute in research. The impact will be challenging without urgent intervention. I've therefore directed the Minister of Finance to make immediate financial arrangements to mitigate this loss. And I expect that this will be reflected in his budget, which will be presented to this House next month, on March 11th. Working with the NHIA will revive the Onuado mobile healthcare vans. Yes. These vans will provide OPD, ophthalmology, dental, ENT, cancer screening and care in the remote and most vulnerable communities in our country. An earlier attempt to provide mobile health facilities was abandoned after the change of government in 2017. Mr. Speaker, public health experts are grappling with the conundrum of new diseases and re-emergence of old diseases. The unpredictable nature of disease outbreak suggests we must make our health systems more resilient to shocks. Since October last year, Ghana has faced a severe cholera outbreak. As of February 17, 2025, I'm sad to report that 6,300 suspected cases, 545 of these cases were confirmed to be cholera, and unfortunately we lost 49 of our compatriots. The outbreak has affected 118 districts across the Greater Accra, Central, Western Ashanti, and Eastern regions. To control the situation, we have launched an aggressive vaccination and public education campaign, among other interventions. Mr. Speaker, sanitation within the context of infectious disease outbreaks, personal hygiene, and environmental sanitation must be a major priority for us. Our cities and towns must be made cleaner than what we currently have. We commit to right the wrongs and keep our cities and communities clean through appropriate investment, supervision, and performance tracking in the sanitation sector. Mr. Speaker, as I speak, the Upper West region is facing a severe meningitis outbreak. And I know, Mr. Speaker, you have made an important contribution to ameliorate the situation in your region, and I commend you for that. As of February 17, 2025, 135 suspected cases of meningitis were reported. 22 of those cases were confirmed, and unfortunately, 16 deaths have been reported across 10 districts. We've instituted free treatment for affected persons and deployed a strong national team of health experts to encourage early reporting to health facilities of suspected meningitis. Mr. Speaker, as outlined in the 2024 manifesto of the NDC, my administration is actively developing the framework for the rollout of the free primary health care program. When fully implemented, this initiative will mark a significant step towards Ghana achieving goal number 3.8, which is universal health coverage of the SDGs, by eliminating financial barriers to basic health care access. Also in line with our 120-day manifesto commitment, the composition of the technical committee is far advanced, with plans to establish the Ghana Medical Trust Fund, also known as Mahama Cares, in the coming weeks. Mr. Speaker, honorable members, this fund will be dedicated to financing the treatment of non-communicable diseases, which have seen a significant rise over the past decade. As part of this initiative, the government is committing to allocate financial resources towards this project in 2025, with further support to be mobilized from private sector partners to ensure the sustainability of the fund. Once operational, the Ghana Medical Trust Fund, otherwise known as Mahama Cares, will directly address the financial burden of patients who require dialysis treatment, cancer care, and other critical non-communicable disease-related interventions. Together, the free primary health care, which will focus on early detection and prevention and treatment, and the Ghana Medical Trust Fund program, which will focus on relieving the financial burden of treating non-communicable diseases, will help to revolutionize Ghana's healthcare system by improving healthcare accessibility and outcomes and enhancing productivity and well-being across the country. Mr. Speaker, Ghana will become the pharmaceutical manufacturing hub of West Africa. And my previous record in government speaks for itself. When I injected funds into Ghanaian-owned pharmaceutical companies to expand their production capacities. Mr. Speaker, as this exciting phase unfolds under the 24-hour economy initiative, we must strengthen every aspect of our pharmaceutical industry. And this includes the Food and Drugs Authority and the Customs and Security agencies in order to avert the use of fake drugs and the importation of illicit drugs into our country. We await thorough and unbiased investigation into the alleged opioid pill importation into Ghana and other West African countries. The outcome will be shared, and I can assure you necessary action will be taken. Mr. Speaker, as a social democrat, I'm resolutely committed to eradicating all forms of discrimination in our society. Our vision is to foster fairness and cultivate an inclusive environment where everyone can engage fully and equally in social, economic, and political life. With my Vice President, the history-making Professor Nana Jane Opoku-Agyeman, we will engage with all stakeholders, including our development partners and civil society organizations, to prioritize gender equality, equity, and social justice.